Hey guys, do I have the episode for you today? I am super excited to have Diana. You guys might know her as the Faja Doctor back on the show. Hello.
Hey, Mavi. Thank you for having me again.
Hey. You guys, if you're listening to this audio and you're not watching the video, you have to go watch the video because you're going to see Diana and she is glowing.
Thank you. Thank you, girl.
I want to talk. We have a really interesting episode planned for you guys. Diana's going to be my co host for a couple of episodes, so you guys will hear back from her. And we're going to get to the topic of our episode. But one thing I want to touch on before we jump into it, because it's kind of all related, is your glow up from 2021 to now has been amazing. And I'm not
2020.
2020. Well, I'm talking about the first time you came on the show.
Oh, yeah, you're right. That was in 2021.
Yeah, when you came on the show and then just watching your transformation, I almost want you to, and I don't almost do, I want you to brag on yourself. What have you done? And like talk about your glow up because I can see it on the outside. I can see the change and I can see the confidence in your face and your look and your eyes, but I don't know what's gone on behind the scenes to give you that confidence. So I want to hear.
So we just talking about just like physical only.
Just overall, like life transformation after your surgeries.
Oh, geez, because I got like different categories that I can touch on there, but I'm gonna try to summarize. I feel like I had my first surgery, my round one, in 2020, September with Dr. Azizi in Chicago. It was a life-changing experience that not only led me to a path of like true self-discovery and like really being able to finally start to learn how to be me or be defiantly me. That's my brand, Body. If you're not familiar, my Faja brand. It led me down a path of completely changing my career. It just like fell into my lap after my surgery. I started in corporate America. I was working in the financial industry, wealth management to be specific. And then I somehow landed in plastic surgery and I love everything about it. And it's been a great success. I started a Faja alterations business, which is how it all began. That led to me really focusing in on the content creation piece, which, by the way, I learned everything from scratch. I didn't know how to sew. I started offering alterations. Didn't know how to do videos, content, figured out how to do that and just kept doing it until I got better and better. Because looking at my old videos, I'm like, oh, this is cringe AF, but okay. And then from there, I figured out how to design my own brand of fajas, of compression garments specifically, and infuse it with my own personal touch. So all of that professionally has also, at the same time, I'm like, learning my body and like working out. I started working out a year ago. Actually, yes, exactly a year ago, because my last procedure, which was with Dr. Andre Marshall in Beverly Hills, love him. Before that last procedure, I started working out because for the longest, I was so busy with my businesses that I just had to kind of put myself on the back burner. And that's fine. That's part of the journey. That's part of the story. And I don't have a problem with it. But finally, last year, I was able to get some help on and everything because I was doing everything by myself. I was able to find some time in my calendar to start to focus on myself more. And once that started happening, obviously you got to put in work. I work out maybe like 3 to 4 times a week. I'm starting to feel a difference. My face looks better. Yes, I have an injector. That's a different part of the story. But like, I would not have been able to afford this injector prior to having fallen into like Mavi. I can really like, it can go really, really deep.
Yeah.
But yes, all of that professionally. Oh yeah. And then me being more confident led to my love life being amazing. So here we are.
Hey, I love it. I love it. So,
And as we know, a good love life gives
a
you
glow.
all of these wonderful endorphins, and the endorphins make you glow. So yes.
Good. So what she's saying is she's been getting it good at home.
Okay. Shout out to the husband. Sorry, guys.
But you know what? I can totally see it in you. In when I talk to you and when I see you in your videos, I can totally see it and I love to see it. So this
Thank
really
you.
ties into our topic today, which is round two surgeries, or round three, four, five, six, sometimes infinity.
Infinity. Yes.
So we're going to dig in and talk about, what does it mean to have a round two? What is a round two? Like, what does that even mean? I think a lot of people are like confused, because having one surgery feels like such a mountain that first time. Like,
First
what?
one.
Round
Yes.
two? You're going to do it again? What? So,
Oh yeah, I remember. I actually remember the first time I came across round two as a term, and I was like, "What? People are going back for more? Like, I am scared of this first one." Literally, what you said is exactly what went through my head when I first found out about
seriously.
this.
So, let's talk about round two. So, the first question is going to be, what is a round two? And we'll go into what it means to different people. So, a round two or three or four is having multiple surgeries done to your body. It really doesn't mean much more than that. Sometimes it
Yep.
doesn't mean like, oh, you have to do as much as you can in what round one, and then round two is like as much as you can in round two, although that is the case sometimes, but that's not what it means. It's different for every single person. So for you, what did round two mean for you? And then I'll tell you guys a little bit about what it meant for me.
Well, round two, you mean like specifically for my
Yeah, like what
case?
is it? What was your round two?
So my round two was essentially to, I was a high BMI case to
What
begin
was your
with. And
BMI?
I knew at the time, I believe it was like
Okay.
35, maybe 34. But I knew going in, I'm very realistic, just like in general. And I did all my research. So my expectations were realistic. And then also, my first round surgeon didn't set me up for failure. He kept it real with me in the consultation. So I went into the whole thing with very realistic expectations, knowing I'm not going to be a one round body. I I even thought I'm probably not even going to be a 2 round body. Actually, speaking of which, there's this thing that I've heard a lot of times on social media: round one, foundation; round two, projection; round three, perfection. Have you
Yeah, I
heard
have
that?
heard that.
So this isn't something I heard back in the beginning of my research journey, but I kind of already, I kind of went into the whole thing expecting like I'm not going to come out perfect, because I know I'm a piece of work. I still need more work, at least to the vision that I have for myself. The first round, we did a whole bunch of liposuction. He did recommend a tummy tuck, but I was afraid of the scar and the recovery. I don't know why, by the way. It it wasn't that bad after all after my second round. But yeah, so all the lipo left me with a apron of stomach skin that was, I mean, it wasn't that bad, but it was definitely noticeable, and it was something that bothered me because it wasn't there before, especially when I sat down or bent over. That's really when you could tell, because when I was standing up, like especially with clothes on, you couldn't tell, like it looked flat. But anyways, for that, I went back in for a mini tummy tuck, and at the same time, those of you who have been following me, you're familiar with my problematic right butt cheek. That one has always been problematic since I was born. It was smaller than the left one. So the right one, we in my second round, we added a little bit more fat to help make things more symmetrical. But yeah, so it was essentially a second round to further improve and fine tune what was done in the first round.
So for me, let me tell you guys about what it was for me. During my first surgery, I had abdominoplasty, lipo 360, and a BBL. And my round two was my breast reduction with lift with implant, or masto aug pexy. You guys have heard me talk about it before on the show. It was something really, really important to me to have that procedure done. And the doctor that did my round one, I wasn't going to go to him for my round two, specifically because I was looking for somebody that did and like focused on breast, who was really good on breast work. Because one thing I didn't like was breast reductions or breast lifts where the breasts look kind of square, or they
Mm.
look kind of, boxy a little. And that was something that I really wanted to avoid. So it wasn't until I found the doctor for my round two, which was Dr. Daniel Andrew here in Houston, and she did my breast, and I love them. They're my favorite. I'm so happy I did it. And so that's what round two meant for me. That's what round two meant for you. For other people, it can be removal of dog ears. That's a really big thing that people go back in for procedures for. Sometimes they do it in the office. Sometimes they take you back to the OR. If they take you back to the OR, it's a good time if you're going to do something else to might as well add it at the same time as you're already going under for the dog ears.
Mavi, would you consider like a dog ear correction if the person doesn't get anything else? Would you consider that a round 2 or more like a revision procedure?
I think that would be more like a revision procedure. It depends on
Yeah.
also if they're taking you back to the OR. A lot of surgeons can fix the dog ear in the office. They don't need to take you back
Yeah, like
to, yeah, with local.
yeah.
But it's a good opportunity too. If you're gonna be going back in, might as well finish it up, because I was gonna go through the different reasons why people go in for round 2. Revisions is one of them. So dog ears, scars that are too wide is another reason why people go back in. Implants that either capsulate or later on you decide you want to go smaller or you want to go bigger. Also, a more liposuction. So this is actually really common when people do tummy tuck lipo procedures together. They can't be as aggressive during that session as they would want to if they weren't doing a tummy tuck. So a lot of women will come back and do more lipo as a round 2. And then lastly, more fat transfer for a BBL. So let's talk about round 2 for BBL.
I have a list because I put some thought into it, and there's a few things I can add to
Yeah,
yours.
let's go for it.
For like reasons to get around 2. Well, one, obviously this one applies to me. Like if you have a high volume case, now you have to prioritize safety, and you can't just do everything in one round. So that would be like one good reason. I am starting to see more BBL reductions. Some went a little too far, and they're like, oh my God, that's not me anymore.
Wait, hold on. I want to point out that when I launched this show, I told y'all, think about it. How is this going to age?
My episode.
Did I do it on your episode?
Yes. Yeah, I remember having this conversation with you.
Because I was already starting to see a lot of reductions back then. Or women coming in after gaining 20 pounds after surgery and like, whoa, it all went to my butt. And now I look like, what are those? Are they sheep? Those sheeps with the big old butts that...
Girl, I have one in my drafts on Instagram that I'm trying to think of something funny to pair with, but I'm going to tag you when I post it.
Because that's exactly, you know exactly what I'm talking about. But
I do.
So I want to say, I did tell y'all, calm down with how much fat you put back there, because it's not going to stop growing unless you stop eating, unless you stop and you get on a diet or make sure that you don't overeat after surgery, because it's going to go to your booty. And your booty will continue to get bigger, fatter. You know, that feed the fat process, that doesn't stop at 6 weeks. You don't stop feeding the fat. You continue to feed the fat forever. And if you don't feed it well, it's going to get big. So.
Right. You have to feed it with the right things.
Oh, you can keep going with your list.
Oh, yeah. Right. Okay. Then, and that's actually what you touched on, irregularities or complications that need to be addressed and fixed. And then in that case, if you're already under, you might as well get something else if there's anything else that bothers you. And then lastly, a lot of my customers go in for multiple rounds because they have like a desired look that they want to achieve. For example, the vixen look. Like, I think anything just a little bit more on the extreme side of the spectrum, that would be a great reason to go under for round 2. And everybody can do whatever they want. For me, as long as you're happy, I'm happy. If you're happy, that's what makes me happy to see, you know?
As long as you're happy and you're safe. When you're thinking and considering having a round 2 of surgery, and before we end the episode, I want to talk about round 2 BBLs and round 3 BBLs and all of that. But I just said that because I don't want to forget. I want to make sure that we all think the same of nobody is perfect, and you cannot chase perfection until you get it, because you won't get it. There's nobody out there who is 100% perfect. So chasing this image of perfection in your mind, it might be harmful. So I've met a lot of women in my career where I've had to be like, hey, maybe it's time to see a mental health professional, because what you are seeing in the mirror is not the same thing that I'm seeing and that everybody else is seeing. You don't
Yeah.
see the beauty that we see because there's some mental block there.
Yeah.
So I think that's really important for us to address, of chasing perfection. We've all seen those stories of like, so and so had this many surgeries and now to look like Barbie, or they had this many surgeries to look like this person and they look completely deformed. They don't look like themselves. It might be a temporary happiness, but
Right.
eventually, how is all of that going to age?
Right. Right. So I can actually talk about how I'm handling it with the realistic expectations. I am the opposite of pop perfect. Like anyone, all these people giving me compliments online, so, so sweet. But like, I'm not perfect, not even close to. I don't claim to be. But I have one more round in me because I want to get some more liposuction. I have a vision of myself that I want to achieve. And for me, it's how can I summarize it? It's essentially a woman who's shaped in a curvy way where you're like, this, is she natural? Like, that's the question that I want. Not like, oh yeah, she had a BBL. That's what I don't want that. So like my goal is like, essentially that, like a natural but very like just like beautifully shaped, in my eyes, feminine, curvy, like small waist, big hips, but in a natural look. So I want that. However, I also have cellulite. I also have skin laxity in my thighs. I also have this and that and who knows what. And I'm completely fine with it. I have stretch marks. My belly button, since I only had a mini tummy tuck, is still my natural belly button. And it's not like a tiny little, like it's like a slightly sad. So, but it's okay. And those are the things that I'm okay with. And that's where I'm like, okay, I don't need to be perfect, because everything else my personality will take care of. But like,
A personality on A plus.
okay, yes, cannot decline. So I'm just like, okay, I want some more liposuction just to get to a point where I can like be fully free of really feeling insecure about my biggest insecurities that I actually wrote on a list that I organized by like priorities before my first round. I have literally a top 10 list. I told you about that
I
on one of my past.
remember. I remember.
But yeah, based on that, like I'm like aware of my insecurities, and I'm doing something to address them. And for everything else, I'm going to the gym, skin laxity. I have like a little bit of like skin discoloration, minor, but like on the upper back of my thighs. I'm using salicylic soap, every single day.
You say
I'm
it's
addressing it. Like anything that there is, I'm addressing it with different tools that are available to us. So why not, use plastic surgery as a tool as well, right?
I have nothing against multiple rounds. Go for as many rounds as you want until you feel however you want to feel, happy with what you see in the mirror. What I'm saying is it's a slippery slope down chasing perfection. After your next surgery, then if you're like, you know what, I want a little bit more over here and I want a little bit, can you pull this here? And it's never ending. We always want something. If I stood in the mirror and I'm like, oh, okay, I would do this, 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 this,
Yeah.
but then I wouldn't even look like myself by the end of it.
Yeah, you got to be careful with that.
Yeah, especially when you're talking about round two for your nose, round two for your face, different procedures that in areas that you can't really camouflage, like your face, for example.
Yeah.
Let's talk a little bit about round two BBLs. So, round two fat transfers. And there are a lot of women out there who had a BBL round one thinking this was going to be it. Actually, thinking, please don't make it too big. Please don't make me look crazy. And then
Chick.
a year later, 6 months later, they're like, "Ugh, I need a round two. I need more fat in my butt."
Yeah. This happens by week 3. Okay.
Mm-hmm.
They're like, oh, but all the swelling suddenly goes away. And you're like, I lost it. But then you're not aware that you're not a pro at this. You don't know that your waist is still going to shrink a lot. So your booty will look bigger than it was before. But yes.
Wait, yes. So round two fat transfers are for people who still want more volume, who still want more shape. and who are still not happy with the overall size of their BBL. Other reasons are to have around 2 BBL is when the surgeon that you chose for your round one wasn't specialized in BBLs and fat transfers. So why do I say that? Because every single plastic surgeon does things differently. I think Dr. Marshall said this in one of our episodes, and it's an analogy that's kind of stuck with me of if you ask 10 surgeons to draw a banana, they're all going to draw it, but they're all going to draw it different. Every single one's going to draw it different. So it's very similar to when you ask doctors for a BBL. If it's a doctor and you found him and you didn't go to him specifically for his BBLs, you went to him because he does amazing belly buttons, for example. And while you're there, you're going to do a fat transfer. And then you do the fat transfer, but you realize that not a lot of your fat stayed. Maybe it wasn't shaped the way you wanted it to. And now you're looking at other women's BBLs and you're like, wait, how come my BBL doesn't look like their BBL? And so you go down this spiral of, should I change doctors? The doctor that I have will fix it. He will fix it for less cost. Sometimes they'll let you just pay the hospital or anesthesia fee and they'll waive their professional fee. All of these are literally conversations I've had with women about different things that are going on in their situations or in their surgical journeys. The question is, should you go back to the round one doctor or should you switch? And you are a good person to ask that because you did switch. I switched too. I changed my doctor. I already told y'all why.
So my so I had one full BBL. My second round was just a BBL on my right butt cheek. So my left butt cheek is one round. My right butt cheeks, I know, girl. It's such a mess, but it is that's what it is. I chose a different surgeon because I wanted to experience something else in the sense of, just a different plastic surgeon, how a different plastic surgeon does things. And then also I was just like really impressed with his work. I loved his work. And we're like really cool. Like he was always commenting on my memes and like blowing my head up and telling me that I'm funny. So I was like, oh my God, I like him. So because of that, and I mean, obviously other reasons, his patients look fabulous. So like, you know what I'm saying? And then him and my first surgeon are actually friends. So it wasn't like I was like, ooh, I don't want to go back to my first. My first surgeon changed my life in the best way possible. I love him. But I wanted to experience what this hybrid doll life is talking about. Hybrid doll, if you don't know what that means, is this plastic surgery term for a plastic surgery doll, aka a woman who had plastic surgery in her life, who went to more than one different surgeons. So you're a hybrid between, for this scenario, look at plastic surgeons as artists, because that's what they are. They are artists in the medical field. You're putting two amazing artists' work together and on your body, and you're the piece of art. So that's how you can look at hybrid doll. And I was just like really curious about that because I've had several customers of mine who were hybrid dolls and they just like always looked so freaking good. So I was like, okay, let me find out. And actually the final round that I have in me, hopefully within the next 12 months or so, I will be posting about it on my socials. Going back to Dr. Marshall for that one again.
Okay, what are you planning to do in round 3?
Mainly lipo 360 and then a little bit more on my right cheek to really get it like, and not like, just a little bit more matching. Because my right cheek and my right hip just have always been smaller than the left. Like, again, since I was little. So I'm just trying to get a little bit more of that symmetry.
Let me see you. Stand up. Oh. Show us that booty.
Uh-oh.
Can I see you? Can I see it from there?
I don't know. Let's see. I don't know if you can tell. I don't.
No, I can't see. Oh, look at that. Hey, it looks good. I love that dress.
Thank you.
In your experience, was it you were happy with going with a different surgeon for that second round?
I mean, I'm a very loyal person, so I messaged Dr. Azizi way before anything really, like any triggers were pulled, just to like make sure he wasn't blindsided and to make sure that he knows that I'm not like not going back to him.
Mad
because
at him.
I don't like his work, because that's like the furthest from the reality for me.
And for this next part, BBL or round 3, are you adding any additional body parts or is it just Lipo
I have
360?
thought about my arms, but I've been really working on my arms in the gym, so I think I'm going to leave them alone. I have considered just a little bit of my inner thighs, like at the top where it rubs together, because when I wear dresses, it can get like, it just can get terrible. So I was
Uh-huh.
considering like like a small amount. Not sure if I want to do that though, because could that potentially make my skin laxity worse that I already have a little bit, right?
So inner thighs, before we're gonna end the show on this. Inner thighs, liposuction,
I
do not, if you already have a little bit of looseness
don't do it.
there and you have high volume liposuction, you're just gonna be left with that looseness with no
Right. That's what we do.
volume. So that's what we don't want. So I would say even if you leave your thighs a little bit fuller to avoid having that excess skin, because it will, unless you're like so rubbing together so much that you have issues, then of course do it. But if it's not, and if you are already know yourself that the loose skin is going to bother you more than the little roll, because I have seen a lot of inner thigh lipo
Yeah.
in thousands of women,
Yeah.
thousands.
Because
And
of that, I'm most likely not going to go with it, because I do a lot with my legs in the gym too, just to fine tune my chin lipo a little bit, but like on the jaws, like everything here is fine. I just want like, I feel like when I had my chin lipo, it was just done here, because
uh-huh,
jawline lipo wasn't like super popular or huge or talked about. But now everybody's talking about jaw
uh-huh.
lipo. So I'm like, ooh, I have like a little bit, very minor. I could live without it. But I just, if I'm already under,
You're like, since I'm gonna be
right, since I'm going to
under.
be under, and this is a small add on. So I'm cool with that. Lastly, obviously, I might do it on my thighs. But 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 I have
Oh,
on the sides of my thighs maybe 3 dimples each that are a little bit deeper. It would be nice for that skin to be smooth. You know what I mean? It would be nice.
yeah.
So maybe I will add Avili on, because I had a great experience with that for my booty.
And before we go, this is the last question, and then we'll go. How was your experience with the 2 different post-op recovery requirements? So I've had Dr. Azizi and Dr. Marshall on, and Dr. Azizi's like, don't sit for 3 weeks. Dr. Marshall's like, don't sit for 12 weeks. So how was it for you,
Well,
that
with
difference?
my last procedure with Dr. Marshall, I could sit right away, so I didn't really experience that. However, I have to say, and you know this, you said it before, we are the worst patients. I am definitely like the right cheek that I'm going to have Dr. Andre Marshall help me with. I'm going to avoid sitting on it until I no longer feel discomfort there. So for me, it's going to be more of a listening to my body, but it's definitely going to be like a minimum of 3 weeks of like just like left cheek all the time, and knees, elbows, but mainly on my
Yeah.
left cheek. So, I'm already mentally prepared for that. If it takes 6 weeks and it still is very uncomfortable at 6 weeks, I'm still not going to sit on my right cheek. Again, I'm just going to listen to my body. But
Yeah.
I've already had like multiple procedures. So I'm more in tune with listening to my body, which if I was about to get my round 1, I would never be in tune like that.
I told you, you get to know yourself to like
You
the
really
100th
do. You
level.
really do. But in a great way.
Another thing I want to point out, you and I are 2 different examples of patients who go through the surgery process and follow different post-op instructions. And I want to point it out for our listeners because I know a lot of them are battling with having BBLs and not being able to sit down for 6 weeks and hearing conflicting peace stories online and all of these different recommendations.
I
You were one of the BBL dolls who actually followed the don't sit on your butt and like be on your knees and elbows all the time. I sat on my butt day one. Like I never stayed off my butt. I was recovering from a tummy tuck at the same
You are
time,
such a
so
rebel.
I
You're
never stayed
such
off.
a rebel.
I was the complete opposite. And although I my booty is already, you know,
Bootying.
big. I can't even imagine if I did kill some of that fat, good, because it would be a lot bigger than this. I point that out because I know a lot of the women out there are like thinking, oh my God, if I even sit on the toilet for a second, I'm going to ruin my BBL. Or even if I sit in the car and I do this and you're going to be fine. If the surgeon that you went to knew what they were doing as far as processing the fat and injecting the fat, then you have nothing to worry about. Your fat will stay. Whatever's still there after 3 weeks will probably stay there.
Dr. Azizi, actually, oh my God, like, I'm trying to use the bathroom number 2 and like, I'm constipated because it's like about to be like the first one. And it's like literally like going into labor. And I was like, am I going to kill my fat? Because like I'm sitting on the toilet for like 15 minutes. And he's like, oh my God, please don't worry about that. Like, this is like such a short window of time, like 15, 20 minutes. Just like try to like lean forward to like take a little bit of pressure off if it feels uncomfortable, but you will be okay. It will be okay. Don't panic. Now, if you're sitting on it for like 2, 3, 4 hours, I don't know. I didn't try, so I can't tell you. I can't tell you what happens.
So for me, I sat on it but I was definitely moving, rotating, kind of not just my 100% weight on it while I'm laying there. Y'all know I had my little nest and my little throne that I would sit on and make sure like my knees were up, my booty was in the hole of my pillows, so I didn't have all of that pressure like on my booty. So I say all of that to say that if you sit on your butt, you will be okay. If you don't sit on your butt, you'll be okay. Either way, it'll be fine. Don't stress yourself out. I've seen some girls who have like knee burn and elbow burns because they're just spending so much time on their hands and knees. And I'm like, it doesn't have to be that drastic,
because that was me. It wasn't burned, but it was like very sore, my elbows and my knees. Icy hot spray and icy hot gel. Mwah. Like the way that helped me, I can't even describe. So yes, let's do that. Icy hot. And by the way, speaking of round 2, I wouldn't be the Faja doctor if I wouldn't talk about fajas. Do you need another faja for your round 2? Are you still going to be able to reuse your fajas from your round 1? In my case, I needed new ones because my right cheek got a little too big for the first one, so I needed to go up a size for the hips.
And always have 2 fajas. One for you to wear, one for you to wash.
Yes.
So you can alternate.
Absolutely.
Okay, guys. So, Diana, thank you for being on the show with me today. And you'll be back for the next episode. Diana will be with us as a co-host. And you guys will hear a lot more about her and her story and just her magical transformation.
Thank you for having me, on the show, Diana. Fun.
And we'll see you guys next week.
So if you're listening to this episode and you're listening to the Big Butts No Lies podcast, you might be on your surgery journey. And if you are, and you don't know what to do, you don't know where to start, you've come to the right place. I am so excited to do one-on-ones with you guys. I've realized as I do them more and more just how valuable they are to you, not only because you get my expert opinion, I get to guide you towards plastic surgeons that we know are going to do a good job and keep you safe. Besides all that, I get to talk to you about things that might not even be on your radar, things that you don't even know are possible. But since we get so in depth with our conversations and I really get to know what your dreams are and what you're really looking for with your body, I can tailor my recommendations to the surgeons that I know can help you achieve that. And taking the guesswork out of who to go to is invaluable. So schedule your one-on-one phone call with me. You can go to my website, go to the quick links, submit your information, let me get to know you. Let me see how can we help you. You can get your own team. You guys, I have been working so hard behind the scenes to come up with a perfect way for you to have your plastic surgery and not only come out with beautiful incisions, but also feeling beautiful on the inside. So book your call with me and take the guesswork out of your plastic surgery journey.
And don't forget, new episodes every Monday. I'll see you then.